In this video, I'll discuss whether you need to sign up for Part D, and if so, the two best ways to find out which of the dozens of plans that are available in your area is the best match for the prescriptions you take. I'll also discuss what types of services Medicare doesn't cover, like dental, vision, and hearing. So let's get started. Who needs Part D coverage? Well, some people on Medicare have coverage through the VA or an employer, union, or military service like TRICARE for life. Now, if you're eligible for the VA prescription benefit, or if you're covered by TRICARE for life, you don't need to sign up for Part D because those coverages are expected to pay as much as a Part D plan would pay. Now, let's take a look at what happens if you have an employer or union coverage. You really want to check with someone from your employer or union before making any changes to your coverage for the following reasons. If you drop your employer or union coverage, you may not be able to get it back. And also, you don't want to accidentally disenroll your spouse or other dependents from their insurance. If you have group insurance and you haven't downloaded my group insurance checklist yet, you can get it by going to my website, medicarepersonalized.com, or drop me an email at medsupshopper@gmail.com and I'll get you one. Now, assuming you don't have one of the other prescription drug coverage we've already discussed, I'm assuming you'll want Part D even when you don't take any prescriptions, and here's why. If you don't sign up for Part D when you first become eligible, and then later you decide to sign up, you'll be charged a lifetime premium penalty for not having signed up when you were first eligible. So for people who don't take any prescriptions, I recommend signing up for the lowest premium plan, which charges around $15 a month. If you begin taking prescriptions, you'll be glad you have it, and you'll also be able to avoid any penalties. Now, when can you join or switch Part D? It's when you first become eligible for Medicare, or when you first get Part B. Every year you can switch during the annual enrollment period between October 15th and December 7th. And then, if you do qualify for extra help, which is a government program for people with really low incomes, you can also sign up at that time. So, how do you sign up for Part D? Within 60 days of becoming eligible for Medicare Part A and/or Part B, or during the annual enrollment period, simply visit medicare.gov, click on the tab, find Health and Drug Plans. Then you have to type in your zip code. Just kind of follow the prompts. It's pretty intuitive and most people don't have any trouble navigating it. You'll then type in your prescriptions, the dosages, and your preferred pharmacy. Now, that doesn't mean you can't get it at other pharmacies. It's just that if one pharmacy is closer to you than another, and you may prefer that, the website will then return the best match for that list of prescriptions. Look for the one that has the lowest total out-of-pocket cost. Now, what are Part D total out-of-pocket costs? There are three parts that determine what is total out-of-pocket. The first one is your monthly premium that you pay for the plan. Secondly is any deductible that plan requires. And third are the copays that you pay when you pick up your prescriptions at the pharmacy. Now, if you decide that doing it yourself is above your pay grade, then you can call Medicare at 800-633-4227. They answer the phone 24 hours a day. If you call after normal office hours, your wait time should be shorter. When the person answers, they'll just do what I showed you here. They'll take your drug information and they'll go through this process with you over the phone. And then if you want to enroll at the end of it, they'll take your information. I have so many people tell me that they're just going to stay with their current drug plan because they're happy with it. What they don't understand is that they could be in for a big surprise when they go to fill their prescriptions. So I always advise people to review your prescription drug plan every year. And I've compiled 5 reasons why you should do that. Your current plan premium may change. The deductible may change. Your copays may change. Your list of covered drugs may change. And your health may change. So might your prescriptions. All of these things can impact your total out-of-pocket cost. By simply doing this every year, this advice can literally save you hundreds of dollars each year. Now, switching topics. Let's discuss typical services that are not covered by Medicare. This is straight out of the Medicare and You book. It says, Medicare doesn't cover everything. It's not going to cover most dental care, eye exams related to prescribing glasses, dentures, cosmetic surgeries, acupuncture, or hearing aids, and exams for fitting them. There is supplemental dental, vision, and hearing coverage available from private insurance companies for about $1 per day. We're coming down the final stretch. In our last video, I want to make my recommendations for the Medicare supplement plans that I feel is the best fit and value for the majority of people that want a supplement. I'll also let you know how to find out which company in your area offers the lowest rates for any plan that you're looking at. Now, just in case you've forgotten something, you can ask me any questions by calling 800-465-3164 or check out our website at medicarepersonalized.com. Add any comments below and click subscribe to get access to all of my videos. And feel free to share this video with anyone that you know who could use this information. Thanks.